afternoon, I'm Jill Valley. In just a few moments, Montana Governor Steve Bullock is going to host a news conference. He is to provide updates on Montana's response to COVID-19 and, of course, answer questions from reporters. We anticipate going to him any moment now. The last number of confirmed positive cases in Montana jumped another 22. We now have 354. Let's go now to Helena and hear from the governor.
Was briefed by the hospital CEO, the chief medical officer, the county public health officer, and others. And in taking necessary safety precautions, we also visited with staff at Marias Medical Center, as well as Heritage Assisted Living Center, and we visited with them outside the facilities. Also had the opportunity to meet with Sheriff Witt, as well as the county commissioners. Finally, I also had the opportunity or chance to see the National Guard's mission in action, both visiting with Air Guard members who are working at the Heritage Center and also National Guard soldiers as they're screening passengers disembarking from the train station. Left with any number of observations from that trip. First, the recognition that in large communities and small, that this impacts every facet of a community. And it's also amazing the community support and ways the communities come together. And having a little open forum with the hospital staff of how appreciative they are of flowers being delivered, of the recognition in windows all across the town of people in Shelby recognizing that the healthcare providers are working hard each and every day to keep not only those in need of healthcare safe, but indeed the entire community. Also underscored continuing concerns about the needs for supplies and the challenges of that. And those are things we'll continue to work on each and every day. The topic of modeling, and as people are looking at various models from around the country and trying to say, this is exactly what's happening in Montana, certainly has been a conversation in recent days and weeks. I've asked Dr. Greg Holzman, the state's chief medical officer, to share with you today how we use modeling to guide us in our work and in our decision making, but importantly, why we don't rely solely on modeling. And I understand that this is a time of uncertainty, particularly for Montana families across our state whose lives look different than they did a month ago. I understand that so many are also experiencing economic and financial hardships, particularly those who've been laid off or who have had to take leaves of absence from their jobs. And I understand it's easy to turn to modeling, especially the ones that give us that most optimistic look as we all search for answers and a better understanding of this virus, how long it may last and how much worse it could get. I certainly want to open back up non-essential businesses and operations as soon as we can. I want us to be able to celebrate the lives that we've saved together with our healthcare workers, rather than just howling for our healthcare heroes from our doorsteps each night. I want to return to as much normalcy as possible, as much as you all do as well. That's why we're taking the steps now, so we can make this a reality as soon as we can. Modelings are predictions on what we do now. Our modelings are predictions on what we do now, but it's what we do now that's going to make the real difference on what actually happens. With that, I'll turn it over to Dr. Holzman.
Thank you, Governor. Two major points I kind of want to get across on modeling. The strength of one's model is dependent on the understanding of the science of the current situation. And with COVID-19, a lot is still unknown or only partially known. The second part of modeling is that modeling does not predict the future. It helps us describe possibilities of what could happen depending on what interventions we implement today. COVID-19 modeling are based on many assumptions. We do not know all the science, and we are learning more and more each day. For example, how transmittable is this virus? What is the severity or virulence of the virus? How does it affect different populations? And we can go on and on and on. This information is very important. And when we don't know all the facts, we try to use our best scientific assumptions with that data that we do have. Let me give you an example. You may have heard the term R0. The basic definition of R0 is the number of cases on average, an infected person will cause during their infectious period. So how many other people will that individual infect? A virus may be very infectious, like measles, which has a very high R0, or lower, like influenza. But the R0 does not describe the whole thing on the virus. It also depends on the population it is spreading in. Measles is very infectious, but in the United States, most individuals are vaccinated, and thus it greatly decreases the spread of this disease. We have other issues around measles, but that will be a discussion for another time. Flu is not as infectious as measles, but we see more spread of that in the United States because, one, fewer people are vaccinated against the flu, and this virus can easily mutate, thus allowing another way for the virus to kind of dodge our immune system. The point being here is that the R0, the infectability, is not a stable number. It depends on many factors. And when in epidemiology terms, we are always trying to get the R0 below 1. That's when we stop the spread of the disease. So returning to the discussion of our modeling, once we make guesstimates on these type of variables, such as the R0, we run the models through different scenarios. But with the models, we need to make assumptions here also. For example, we might want one possible outcome is if social distancing is in place. And we'd look at another one as if social distancing is not in place, or if it's partially in place. This gives us data and ideas of what could happen. From the state's perspective, with many different assumptions being put in place on the different COVID-19 models, it is important that we do not rely on one model, as no one model is completely correct. We look at many different models. We also look at our own epidemiological data that is coming in new each and every day, and we talk to providers that are on the front line. We use all this information and more to help us make short-term and longer-term plans. And we continue to modify these plans as we learn more about the virus and the success of different preventive measures. It is important to acknowledge there are variables in modeling that we cannot control. The virulence or the severity or harmfulness of the virus. However, there is a lot we can control, such as social distancing, wearing your cloth mask when social distancing might not be able to occur, washing your hands frequently, trying not to touch your face. That's one I find difficult to do at times and have to keep reminding myself. Cleaning common touch surfaces and others that we have talked about. While we are all doing our best to prevent the spread of the virus and protect ourselves and our neighbors from COVID-19, medical providers and local and state public health are also helping us control the virus. Providers in the state lab are notifying local public health partners regarding individuals who are sick with COVID-19. So we can move quickly to make sure those individuals who are sick are isolated and those who have been exposed are quarantined. We want to stop the spread of the virus before they have exponential growth of the virus within any one community. Where the pandemic goes in Montana is dependent on us. I would like to emphasize once again, modeling does not predict the future. It helps explain possibilities of what could happen depending on what we do or don't do today. I'd like to hand over the microphone to Jim Murphy, who is the Chief of the Communicable Disease and Control and Prevention Bureau here at the state. And he can describe how it works on the ground and how the epidemiologists and state and local public health are working together to try to stop the spread of this virus and protect Montanans, especially those at higher risk for bad outcomes. Thank you.
Thanks, Greg. So I was asked to explain a little bit about how the local process works after a case of COVID-19 gets reported. I think it's important to acknowledge that COVID-19 is something that's new, but it is a reportable disease in Montana. As soon as a disease report comes in to the local or state health department, it gets immediately evaluated to figure out a few things. One is the local public health nurses, or really the folks on the ground that do a lot of the hard work to try to find out where this infection came from. So each case gets investigated to find out three things. One is, where do we think this person acquired the infection? For instance, we know that a lot of our early cases were travel associated, imported into the state of Montana. The second thing that the public health nurses try to find out is when that person interfaced with the medical systems in Montana, was anybody in the medical systems placed at risk? That's a very important step to help break the chain of transmission. The third thing, and probably the most labor-intensive part of this investigation, is to try to figure out who are the close contacts that may have been placed at risk from the person that we are investigating. All of that gets rolled up, and the local health department then goes out and works with the close contacts involved and the case to control the spread of the disease. For instance, the case is put in what we call isolation. If we're fortunate, that person will be isolated in their homes until they're deemed no longer a health risk to anybody, and then they're released after recovery, and they can go about their business without any worry of spread. We do have some people that are isolated in the hospital because of their requirements for hospitalization. Fortunately, we've been able to avoid that in almost every case. The next thing they will do is work with the close contacts. These are people who we think spent enough time or were in close enough proximity to the person that was diagnosed that they are at risk. Those close contacts are then quarantined. Quarantine right now lasts for 14 days after your last exposure. During that time, those people are asked to remain low, not go to work, not place other people at risk, and during that entire period, they're also monitored for any change in their signs or symptoms. Any change in their signs or symptoms will immediately lead to a medical evaluation that might include COVID-19 testing. That's the only way that we're going to be able to break the chain of transmission, is by identifying people who are cases, looking at the people that they placed at risk, then identifying those people if they convert to cases. That's the work that is going on at the local level. In some cases, we get very fortunate, and a case might have literally 0 to 2 or 3 contacts that have to be followed up at the local level. The case of somebody that is returning from international travel that gets back to Montana, not feeling good, stays home, they might literally have 0 close contacts for us to follow up after we investigate that case. In the more extreme cases, we might end up with somebody that has 30 close contacts that need the follow-up and monitoring. And that's where the steps can get really intense for a local health department to keep up with that. These steps, though, are important for people to be able to be assured that we're not putting other people at risk, and that local and state health departments are doing everything that they can to protect the general public out there. It's very important to remind healthcare providers that we work with that we are interested in testing anybody that has signs or symptoms of COVID-19 infection. The State Public Health Laboratory has the resources to test anybody that a clinician feels is at risk and looks like they have clinically compatible illness. Again, this is the only way that we're going to be able to interrupt the chain of transmission. And we're making a lot of progress on that. And we really have the local public health departments out there and the clinicians to thank for that. Thank you.
Thanks, Dr. Holzman, and thank you, Jim. Finally, before I open up for questions of either me or Dr. Holzman or Jim Murphy, I want to acknowledge again that this is a really difficult time for families. And right now, parents are having to explain the many recent changes and challenges in their children's lives. I certainly understand that as a father of 3 kids. Simple things like watching our kids compete in sporting events can almost seem like we used to take it for granted. And I think even our younger kids who are trying to figure all this out are often that much harder hit. A parent relayed to me recently that their 10-year-old, she asked the parents, like, I can't believe my birthday was taken away by our governor. I think it's really especially important in times like this that we do remember to try to find ways to bring joy and goodness into our homes. We have to look for that goodness that surrounds us in each day all throughout this. And while we can't lift the shelter in place for a child's birthday party, know that if any parent wants to email in at governor@mt.gov, that the governor, or I and the lieutenant governor will send out a little video wishing your child a happy birthday. And in light of this weekend, I'm also issuing a directive providing that certain magical creatures may travel throughout Montana to perform essential services. Magical entities certainly do perform services outside of the scope of human ability. The tradition of Easter egg hunts, as an example, has been celebrated by generations of Montanans. I remember as a young child rushing onto this lawn hoping to find that golden egg, and then remember bringing my kids to the Easter egg hunts as well. I think we could all recognize that the Easter Bunny does perform essential services of hiding Easter eggs, supporting the chocolate egg industry, bringing springtime joy to Montanans all over the state. Further, all dental services, including magical ones, are considered essential services, especially during a time of increased consumption of chocolate eggs, yellow peeps, other related spring treats. The Tooth Fairy is uniquely qualified to perform the service of lost tooth collection to remit payment for lost baby teeth. So under that directive, magical entities, including but not limited to the Easter Bunny and the Tooth Fairy, may freely travel into and through Montana to perform services essential to Montanans. Additionally, they may leave behind a gift, for example, eggs, chocolates, fair market value of a baby tooth at every home they visit, and they must follow social distancing guidelines. I've spoken with the Easter Bunny, who's agreed to adhere to social distancing requirements this weekend. We'll be limiting the hiding of eggs and treats to within households and the immediate yards of households. I know I'll be asked what type of authority I have to do this. It's pretty simple. Esther Watkins Arnold, the Tooth Fairy from 1927, and the Velveteen Rabbit from 1922, and all Montana children young and young at heart. So for those of you young at heart tuning in today, I hope you do remember to find joy in each day, to try to look for the goodness around us, even in these times. Now turn it over for questions. If you'd like to ask a question, you can press 5*, not *5, Phil Drake. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask a question. So any questions? First phone question.
Yeah, Governor, this is Troy Stockton from Montana Radio Company.
Hi, Troy.
I just wondered, maybe this is a question for Dr. Boltzmann, but recognizing that models aren't set in stone, the leading models sort of show that Montana hasn't hit a peak yet. But if we look at the numbers coming from the state, it does look like we're stair-stepping down from a peak, I believe it was March 26th. Do we believe that we're ahead of the curve on this thing, and that we beat that model essentially, or is there potentially another rise?
Okay. Aggressive actions.
Yeah. So I hope we're ahead of it, but to be completely honest, probably not. We need to follow out the numbers a little bit farther and see where things go. There's also, while the lab data that we get from our own lab here at the state is very quickly turned around, lab data that goes out, or testing that goes out to some of the private labs, we might not get the results back as quickly. Hopefully they are getting to us as quickly as possible. So I think we need to follow it a little bit longer and see where things are going. We also need to, as Jim Murphy mentioned, really encourage our providers to continue to test. And this will allow us to do the contact tracing, and hopefully we are beyond the curve, but I think we need to move forward as if we're not yet.
Next question.
Hey, Governor,
Hey, Tristan.
So I'm trying to imagine what it looks like when the economy starts to reawaken. And I'm wondering, what are your thoughts on whether the use of antibody tests could help reboot certain sectors of the workforce, assuming these tests are approved and available for wide distribution?
Yeah, and Tristan, maybe I'll turn over to Dr. Holzman, but I would also say, yeah, look, and I'm both reading and looking into, as experts around the country say, how do we reopen this? I mean, it's all also even based on your question, the assumptions of an antibody test being successful and being approved. I don't know if you have anything more to add, Dr. Holzman.
Agree with the governor. There's a lot of assumptions here. There's even some places within Montana that are looking at the antibody testing to see how effective it would be, and trying to figure out the right tests that could be used. The concept of the antibody testing is to show who has already been infected by this virus and thus might have immunity. So I think there's still a lot more to learn on that. It would be a great tool if we do have it available and we start to learn how long that immunity might be, of how long an individual might have immunity after being infected with this virus. So lots still to learn, a lot of assumptions that we're taking on, but I'm glad the research folks are looking at this, and it would be a great tool to have.
Another phone question.
Yeah, thank you, Montana State Press. This is probably a question for Jim, and the comment about that the state is interested in getting anybody tested who has signs and symptoms of the COVID-19 infection. Is that the same criteria that the providers are supposed to have been using all along here, or is that changed at some point?
Well, and Jim can answer it. So what it's been is signs or symptoms of COVID-19 and either direct contact with COVID positive or traveling of an area of concern.
Yeah.
Go ahead.
Eric, I think just to clarify, when testing first became available, because testing availability was an issue, the early recommendations from CDC were concentrating on hospitalized patients. It quickly evolved from that point to where we do have adequate testing now to test people who have symptoms of concern. If a clinician feels that they should be tested, we have the ability to do that. Now, CDC does have some priorities for this, that if we have to prioritize because of volume, for instance, at the state laboratory, we would concentrate on the higher risk patients or the hospitalized patients. But fortunately, the state lab has been able to keep up with demand, and we haven't had to make those difficult decisions right now. So a clinician that wants to test somebody who is symptomatic can order that test, and we encourage them to do so.
So just to clarify, so currently symptoms are enough alone, regardless of whether there's been travel or documented contact?
Correct. Symptoms right now, if they look like they're clinically compatible with COVID-19, are enough to warrant testing, because we have transmission in many communities in Montana. So this would be the prudent thing to do so that we can interrupt the chain of transmission.
Next question.
Yeah, Governor, I guess kind of adjacent to this, I was wondering, the letter from the Montana Landlord Association around today calling on you to redo your order for the state evictions. Is there any reaction or response to that?
Yeah, and I did just get the letter, and look, we have to make sure that as people are sheltered at home, that they have a place to be in their home. And to be clear, even when we made that directive, this doesn't excuse anyone from paying. And there should be an expectation that everyone does pay their rent and pays their rent on time. We'll continue though to then even have discussions with folks in the landlord side. I mean, we know that businesses, affected businesses, including landlords, could be eligible for SBA relief, also with federally backed mortgages, may be eligible for relief under the CARES Act. But we'll continue to talk to the landlords. And anyone that is a tenant, well, during this time, the directive says you cannot be evicted. That doesn't relieve you if you have the ability to pay your rent. There's another phone question.
Oh, this is Holly. Can you hear me?
I can, Holly.
Awesome. Thanks for doing this call. I wanted to ask about testing capacity again. I was on a call today earlier, a different elected official, and a reporter asked a question. And she was talking about in her county, there's not a medical facility. And there's some counties in Montana that just have one testing site that might be a long drive for people to get to. And some of the counties in Montana haven't done any testing. I haven't reported that they've tested anyone yet. I'm wondering if you have any concerns that we're not capturing some of those people who might be symptomatic, but just aren't able to get tested, and if there's any discussions about making sure we're capturing those people.
Well, I do have concerns that someone that's symptomatic wherever they are may not get tested. And I think one of the things, Holly, I mean, the question underscores some of the challenges of looking at the county by county data. Like we even know here in Lewis and Clark County, at times someone from Broadwater County might be tested here, but do encourage all avenues for individuals that are symptomatic to actually reach out to a healthcare provider and try to arrange to have a test. Another phone question.
Good afternoon, Governor. I believe it says that the Abbott laboratory testing units were on their way. Do you have any sort of progress on how the quicker testing?
Yes, so a couple things, Chris. Montana now is to get, or just recently received, 15 Abbott fast test machines. Now, recognizing that these machines can, get a result in literally like 5 minutes, the whole scale can go up to 15 minutes, but it's also one where it's a lower volume test, like where we can batch test literally hundreds at the state lab. That ends up the ability to only do effectively one at a time. We also have a good number of machines in Montana that in many healthcare, both hospitals and some of clinics, that can be upgraded to run the Abbott tests. So we're going to figure out the best way to deploy those tests, but also, like I was on a call with governors just yesterday, and this has been not just from the governors, but someone talked to directly to the folks, the head of Abbott. While we have these machines, there's no expectation of any significant amount of the testing kits until the end of the year. So each one of these machines, until the end of the month. Each one of these machines were shipped with 24 tests. And with those 24 tests, a good handful of them are needed initially to calibrate the machine. So we dropped off one of the Abbott fast test machines up in Shelby today, but it'll still be several weeks before we get sufficient numbers of the testing kits so that these could be meaningfully utilized. Another phone question.
Hi, this is Nikki Willett from Yellowstone Public Radio. Thanks so much for holding the call today.
Sure, Nikki.
Earlier this week, you broke down kind of the racial demographics of people who have tested positive, and I'm curious now how close of contact are you with the Indian Health Service regarding their testing? And what are you hearing from tribal leaders about how the implementation of the CARES Act relief is going?
Dr. Holtzman, do you want to talk about the contacts with Indian Health Services?
Yeah, I can. And
Or,
also Jim.
or Jim?
We both, go ahead, Jim.
Yeah, I think it's a very good question. We work closely at the State Health Department with our partners at tribal health departments and with Indian Health Service. We have been doing a lot of testing on behalf of Indian Health Service at the state laboratory. So I think that we've got a pretty representative sample of what's going on in all corners of Montana, including Indian Country. Fortunately, right now we've seen a lower impact in Indian Country. We're watching that really closely, trying to make sure they have access to all of the resources that we can give them for testing, as well as PPE or personal protective equipment. So far things look pretty good there, but it's something we have to continue to watch close and make sure that services are offered in those settings.
Dr. Holtzman, do you have a breakdown of the number of tests that have come from reservations and been run at the state lab?
We don't have that specific information. It gets a little bit of challenging to look at that because people can get the test elsewhere but live in a different county. Governor Bullock kind of explained this really well with Helena being where we're situated, very close to Jefferson and Broadwater County. This is where you see some of our numbers go out wrong the first time, where we've said a case was in one county and then found out it was in another, is because the test happened in Lewis and Clark possibly, and the person actually was living in another county. So we don't have those specific numbers that are reliable for putting out at this time.
Another phone question.
Hi, Governor. It's Marie from Governor Beach, Montana. Piggyback on that landlord association question, are you considering deferring property taxes for property owners or any other specific options for mom and pop landlords?
Yeah, and Marisa, we will talk to landlords to try to figure out actually, you know, the best solution along the way, as we do in every step of it. That when it comes to property taxes, the vast majority, like over 80% of it, goes to the local level. Local jurisdictions have the ability to waive any penalties for late payment, but that's up to the local jurisdictions.
Phone question.
Another phone question.
Hi, this is Phil Drake.
Hi, Phil. 5-star.
Anyway, have you come to any kind of understanding in terms of up in Shelby, how the coronavirus entered the medical facility and the Heritage Center? I mean, they are not adjoining facilities. So I'm just sort of wondering if you or the full county health department know who brought it in and how it spread and how it jumped, you know, mile across town.
I mean, they're not adjoining facilities, but there are individuals that end up from one facility to the other. There isn't a directive like this was the individual or where it exactly started, but while they're separate facilities in different areas, that there is at times both patients between one or the other and at times staff. Other questions? Yes, sir.
Governor, obviously the change to testing being made, is your office concerned that this is going to suddenly lead to, I mean, or maybe not concerned, but think that this might lead to a much larger number of positive tests here in Montana, specifically around Gallatin County?
Look, I would love for the ability, I mean, the more testing that we can receive, even if it ends up increasing the numbers, the better we have our hands around the impact of this virus and also the potential that this virus is being spread by community acquisition as the local health departments do their job. So I, like every member of the media, like every Montanan, or many Montanans, look at those numbers of COVID-19 positive each and every day. We try in our own minds to ascertain here are the trends. But I also recognize, and I think that is one of the reasons why if someone is symptomatic, they should certainly go to a healthcare provider to get tested. Because the greater information that we have about this, the sooner we're going to make sure, first of all, the sooner that we're going to really get our arms around it. And also recognizing that one of the challenges of this is like when you see here are the numbers from today. Well, that could be a transmission that had happened 10 days ago. So we're always sort of chasing yesterday's actions. But that's, again, why it's so important from my perspective to adhere to the social distancing guidelines and directives. And it is so important also so we can do the contact tracing of individuals that are positive and work our way backwards, that if you are symptomatic, that you should seek out a test.
Final phone question.
Another phone question.
Hi, Governor. This is Kathy Miller with the County Leader.
Hi, Kathy. I can.
Okay, one question that has come up is how long people have to wait for their unemployment payments. With some people having applied up to 3 weeks ago and still not received anything. Is there anything being done to help with that backlog?
Well, there isn't as much. Like, I know that there were 24,000 payments between March 29th, April 5th, and 20,000 unemployment insurance claims. So we have brought both additional staff into our Department of Labor and are doing everything possible that we can to meet what are significant demands.
And I have another question at this time.
All right, for you, okay.
Okay, I understand that there's been, concern or maybe a breakout in Shelby associated with this living facility. In Anaconda, the 2 cases that have turned out positive were workers at a so do you foresee something similar happening here now that happened in Shelby?
I certainly hope not that it doesn't happen in Anaconda or anywhere else, but that's, again, sort of underscores some of the reasons why we need to do everything we can. Like, if you are symptomatic, to get tested. And if you are feeling even symptomatic, to self-quarantine until you can. And it is one that, look, we are a state where, at least before this pandemic, there would be a lot of interaction between individuals, not just, an assisted living facility, but at any number of areas. So certainly there's nothing that we've seen out of Anaconda to date that would suggest that, but that concern is for every single community across the state. Please.
Governor, came out of the Economic Affairs Committee this morning. 64,000 Montanans are currently applying or accepting unemployment. How long can Montana afford to keep making those payments?
Well, I think from my perspective, the unemployment insurance payments, that was one of the first things that we did and got rid of first week, or having to wait a week's delay. My principal concern right now is making sure that if someone's been furloughed or laid off from a job, that we can do everything that we can to actually get them those payments. And haven't looked at as far as duration of the pandemic and overall long-term economic impacts. But it also underscores one of the reasons why trying to take, in consultation with healthcare professionals and others, a measured approach of saying we're only going to be doing our statewide directives in 2-week periods, because I'd love to open up our state and indeed free our economy as soon as we can. Yes, sir.
Who's against face masks from the federal government? You know how soon that will come in?
So, yeah, there are. So the expectation is now that the 80,000, there's about 70,000 more N95 face masks from FEMA or from the Strategic National Stockpile. We've been told now that they will be coming. Some may even be coming this week. So I had been told earlier that they would have arrived. I think that was near the end of March. But I heard from the FEMA regional administrator today, and he's doing a great job in a challenging situation, that we should get the additional 70,000 soon. I'd also note that, just by surveying hospitals and DES needs out there right now, that like the request from them to us is about 490,000. So certainly appreciate those efforts, just like I appreciated the efforts of North Dakota to give us 50,000 masks, as I appreciate the efforts of the Red Cross, American Red Cross, to get us 10,000 masks. And we're working each and every day to try to get the medical supplies that individuals need. I mean, it underscores to me when I'm up at the Shelby Hospital and speaking to the providers, they say, yeah, supplies, even things like the basic toweling, toilet paper, some of those supply chains have broken down for the hospitals. So we're in constant discussion with the healthcare providers, what they need, and working to try to figure out distribution chains to work through what is unfortunately a somewhat broken system right now.
All right, you were listening to Governor Steve Bullock. That was his second news conference of the week, talking about Montana's response to COVID-19. The tone of this one was almost as if he was checking in with Montanans, and he wanted to talk about modeling a little bit. We've heard models, and he wanted to clarify that those seem to indicate how Montana might fare. One said we would have several hundred deaths from COVID-19, and then it was revised to where maybe only a couple of dozen. And he wanted to say those statistics are not the last word in what's actually going to happen. Dr. Greg Holtzman, who's the Montana medical director, says these polls and these models, they don't predict the future. They use many different models in the state to kind of determine the next step that Montana wants to take, knowing that the governor wants to open up the state as soon as he can, but they need to look at this data. And there are so many unknowns with this virus that there's a lot of assumptions to be made. So while they're used as a tool, they certainly cannot be used to give us a false sense of everything's okay right now. This is going to be a marathon rather than, just a road race, because where this all goes depends on us. We did hear that, there's some antibody testing going on in Montana to get them to know a little bit more about the virus. Again, it's such an unknown disease. And they're encouraging more testing by doctors of patients who have symptoms, but who may not be high risk. They're hoping to get more tests by the end of the month. They've also just got some of these fast testing machines that could give results faster. One of those is up in Shelby at the Marias Medical Center, where that community has seen 3 of Montana's 6 deaths. The governor says he knows this is hard. He's hoping Montana families will find joy somehow. He celebrated our public health nurses, calling them the heroes on the ground. And perhaps the most important thing, he did say the Easter Bunny and the Tooth Fairy are considered essential workers in Montana, so they will adhere to social distancing rules. The Easter Bunny will be around this weekend. And he said, if your child is upset that the governor shut down the state for their birthday, email him and he will send your child an email greeting to celebrate their birthday. It's nice to have just a little levity in all of this. All right, we'll have more on what the governor said and how Montana is responding to COVID-19 coming up on the 5:30 news in just a little over an hour. Thanks for joining us.